Hi, I am Dr. Felice Gersh, your integrative OBGYN physician. Today we're going to talk about a huge issue, which I will bet you anything has impacted many of your own family members or friends, or possibly yourself. And it is the topic of perimenopause and menopause and mental health in women. Women suffer so much more than men do from mental health challenges. In fact, as a general statement, women have twice the incidence of depression and anxiety compared to men. And that's not to minimize the mental health challenges of men. Now, what happens as women transition into the menopause and they lose those vital life hormones, estradiol and progesterone? Well, as a general statement, if a woman has not previously had any mental health problems, they've never suffered from depression or anxiety, their risk of developing a totally new onset of a mental health problem doubles, literally doubles overnight once they head into the perimenopause. What about a woman who previously had a mental health issue, such as postpartum depression, PMS or PMDD, or just generalized anxiety disorder, social anxiety, depression of any sort, bipolar disease, any kind of previous mental health challenge? Their risk of having a new exacerbation of a mental health issue goes up 400%. Women in their 40s are treated in great numbers for mental health challenges. And in fact, something in the neighborhood of 25% of women in their 40s are newly prescribed antidepressants. So what is going on? Well, this hasn't really been given anywhere near the attention it deserves. Many women in their 40s, mid-40s, and early 50s have a lot of challenges that are not specifically related to perimenopause or menopause. For example, they may have issues relating to their husbands. They may have marital challenges. Maybe their husband is going through a midlife crisis. They may have aging parents who are facing challenges of their own, and they, as a daughter, are trying to help out, and they have a lot of stressors relating to parental issues. They may have teenagers, young adult children, sometimes actually quite young children, depending on when they had their kids. And so they have issues involving their children, particularly teens. If anyone has had a teenager, you know that can be a challenging time for parents. But separate from all of that is what's happening with the changes in the hormones. So let's look at what is specifically happening in the body and in the brain that is creating this high incidence of mental health challenges. Well, one obvious thing that I'm sure you all are familiar with is sleep problems. When women have hormonal imbalances, the issue of sleep becomes really huge. And it's not just, but it does include night sweats and hot flashes. They will disturb sleep, but it's more complex than that. Even without the night sweats and hot flashes, it's been shown that women will have a high incidence of sleep disordered breathing, like their sleep phases are not right, things are just not right, and they're not getting the quality of sleep, the deep phase sleep, the REM sleep. They're not having quality sleep, even when they get through the night. But many women will have awakenings, they will have trouble falling asleep, and they may also develop new onset of sleep apnea. That's where they have little tiny pauses, and sleep apnea in women is quite a different creature than in men. Rarely, not impossibly, but rarely do women have visual pauses in their sleep and their breathing. They will often not snore, and the amount of time that they pause in their breathing can be a fraction of a second, just enough to disrupt the phases of sleep so that they do not get quality sleep. And then they end up having a sleep deficiency state and a lot of fatigue during the day, which can lead also to brain fog and mood disorders. Lack of adequate sleep is well known that it will be related to increase in mood disorders. So that is one area, is sleep disturbance. Now you could say, why are women having these sleep disturbances? Well, it turns out that every area of the brain has estrogen and progesterone receptors. The type of estrogen that the brain loves is estradiol, the kind of estrogen the ovaries make, and they're not making it as efficiently in the perimenopause with swings and the general decline. And then, of course, during the menopause, they don't make it at all. So the brain becomes an estradiol deficient organ, and that has a huge impact on sleep and the ability to fall asleep and stay asleep. In addition, in the brain resides the master clock. This is a complex of neurons called the suprachiasmatic nucleus. It's a conglomeration of neurons that sits atop the optic nerve. The optic nerve is what is involved in sight. So this complex of neurons can perceive light and dark that is transmitted from the retina directly to the master clock, so that the master clock knows, is it day or night? In addition, the master clock can perceive nutrients, so that it knows like what time you've eaten and so on. And that's one of the things that we can use as a tool to help us to get our clock back on track. What happens when you don't have enough estradiol, which has receptors in the master clock? The master clock, the word that's used is it drifts. So you have a dysfunction of the settings of the circadian rhythm, so that the brain isn't quite sure what time it is. And often there are early morning awakenings, like 2 a.m., 3 a.m., because you have a phase disruption. The brain may think it's 6 o'clock in the morning when it's actually 2 o'clock in the morning. Well, that is going to have a huge impact on quality of sleep and mental health. Now, in the brain, you have neurons that are involved in the production of neurotransmitters. Well, one of the critical neurotransmitters, or of course all critical, is serotonin. Serotonin has specific neurons that make it. This neurotransmitter is critical for feeling happy and well. It's the target of SSRIs, those pharmaceuticals that are used to treat depression and anxiety. Some of the brand names you may have heard of would be things like Zoloft, Lexapro, Celexa, Prozac, Effexor. So these are very commonly prescribed, and one of their mechanisms, presumably, we're not even totally sure, is to increase the length of time that serotonin, this neurotransmitter, sits in the synapse, the space between the neurons, which will hopefully, the goal is, increase happiness, calmness, a sense of well-being, reducing anxiety and depression. Well, it turns out that serotonin will not be made properly in an absence of estradiol. Estradiol is critical for the production and function of serotonin. So that is going to obviously have a huge impact on mental health if you don't have enough of this really important neurotransmitter. And to compound matters, from serotonin is derived melatonin, the hormone that is so critical for sleep and many other things in the body. So we have this real problem in terms of the production of serotonin, but that's not where it ends. There is another neurotransmitter in the brain that relies on estradiol for its proper function and production, and that is dopamine, which is also vital for mental health. So you're not going to have proper production and function of dopamine. Now, there is another neurological system in the body that is related to the brain. It also interconnects with the brain and also goes peripherally throughout the body to the gut, to the heart, to every organ. And that is called the autonomic nervous system. The autonomic nervous system controls everything we don't think about, like our pulse, our temperature, sweating, the production of digestive enzymes, peristalsis, movement, motility of the gut, contraction of the bladder, our blood pressure, whether the arteries are constricted or relaxed. So everything that we don't think about, which is most of what happens in the body. We don't think about what our body should do. Like, now I want my eyes to tear, I want to make saliva, I want my pancreas to make digestive enzymes. Fortunately, we don't have to think about any of that. Well, one of the neurotransmitters that's involved critically in the autonomic nervous system is acetylcholine. Now, in the brain, acetylcholine is critical for cognition and creating and storing memories. So in the brain, you won't make enough acetylcholine if you don't have enough estradiol, which is one of the mechanisms whereby women have a much higher incidence, like double the incidence of Alzheimer's compared to men. And this is age matched. So the same age, women will have twice as much Alzheimer's as men. That's a huge deal. So of course, you know this. There's a big relationship between cognition and mood. For example, women who have Alzheimer's disease will also have very labile, unstable mood problems. Like they'll cry, they'll be upset, they'll be anxious, as well as having memory problems. The brain is all interconnected. So acetylcholine production going down is also linked to both cognition and mood problems. Now, in the autonomic nervous system, acetylcholine is the neurotransmitter for the parasympathetic nervous system. That's the part of the autonomic nervous system that is sometimes called rest and digest. It's where you should be most of the time, calm, peaceful, all's right with the world. And the sympathetic part of the neurological system is what gets activated when you need it to, in an appropriate situation, because of a stressor, like you're being attacked by a wild animal, you're injured, you're being invaded by bacteria, viruses, pathogens. Then you go into the stress mode, and the sympathetic part of the autonomic nervous system is upregulated. The neurotransmitters for that part of the autonomic nervous system are epinephrine and norepinephrine. They're very well known. If you give an EpiPen, you get a shot because you have a problem, you'll dilate your bronchial tree, so you'll breathe better. In addition, your heart will beat faster. That's part of the stress response. So women in menopause, and this starts in the perimenopause, will have reduced vagal tone. The vagus nerve is not activated enough because of an insufficient amount of the neurotransmitter acetylcholine. So you go into the default state, which is activation of the sympathetic stress response. So women who are transitioning to menopause are always in a stressed state compared to what they were previously. And women tend to that naturally anyway. That's just how we're made. So you end up having less calmness, peacefulness, good motility of the gut, good digestion, vasorelaxation, and you go into the stress state, so you get more palpitations, you feel wired, you feel anxious, because it's like you're ready for the attack. Well, there is no attack. Well, hopefully not. You're just in that stressed state. And of course, that's a mood problem. You're going to feel anxious. It's like, oh my gosh, I feel so anxious. That's because your parasympathetic nervous system is down regulated when you don't have enough acetylcholine and you're more in sympathetic mode, stressor state. So this is why women have more anxiety as they transition into menopause, because of the dysregulation of their neurotransmitters and the autonomic nervous system. So now you know they have problems with circadian rhythm, which cause more sleep problems, and they have problems with their neurotransmitter production, their autonomic nervous system. So butyrate is one of the 3 short-chain fatty acids, but butyrate is unique in that they all have very important functions. Butyrate has actual receptors on the vagus nerve that part of the autonomic nervous system that makes you have proper motility and makes you feel calmer and happier and more at peace. So now you have a double whammy. You don't make enough acetylcholine and you don't make the butyrate to bind and actually make the autonomic nervous system more vagal predominant, more vagal tone. As well, butyrate can actually go in the circulation and go to the brain and make the brain happier too. So that's not happening. Now, when you have leaky gut, impaired gut barrier, the toxins within the gut, in the lumen inside, and now you have the wrong bacteria, and all the toxins that are in the gut and partially digested food and such, they can pass between the cells into the body proper, where the immune system, called the gut-associated lymphoid tissue, the GALT, lines the intestinal tract. And the immune cells are also controlled by estradiol. And without enough estradiol present, they are more reactive. In other words, they create a higher degree of inflammation with a lower trigger. But now we have toxins and inflammatory products called lipopolysaccharides or endotoxins coming into the body proper, activating these immune cells, because the immune cells say, oh my gosh, what is this stuff coming in? I'm going to do my thing as inflammatory cells. And they put out inflammatory cytokines and create inflammation, which goes throughout the body, including into the brain. It crosses into the brain. So now you have neuroinflammation. And this is like the whole new understanding in psychiatry, is that neuroinflammation, inflammation in the brain, underlies cognitive and emotional states, problems. So if you have neuroinflammation, you're going to have mood disorder. So you can see how women, when they transition into menopause, have a huge problem with mood issues. Now, you have neuroinflammation, you have gut dysbiosis, and then when you have dysbiosis and you don't have proper motility, you're not going to have proper digestion, and you will have nutrient insufficiencies. If you do not have enough magnesium, you're going to be more prone to anxiety, and from magnesium you make neurotransmitters, then you're not going to make enough neurotransmitters because you don't have enough magnesium. The same thing with B12. If you don't have enough B12, you're going to have neurotransmitter deficiencies, you're going to have mood problems and cognition problems. And you can go on down the line with all of the vitamins and the minerals. If you don't digest properly, you will have micronutrient insufficiencies, which will affect everything, including the brain. So, what's the solution? Number one, give hormones. Give bioidentical hormones in the perimenopause. The solution, I'm not saying it's never appropriate. I'm not saying that at all. But the solution to a hormonal insufficiency state isn't an antidepressant. It is not. It may be needed in some cases. I'm not saying there's no place for it, but it is not the answer to a hormonal insufficiency state. Oh, and I didn't mention one thing else that I wanted to mention, and that is thyroid. Thyroid hormone does not work properly in an absence of adequate estradiol. And what about progesterone? A hormone that I don't talk about enough, and I'm going to talk about more. Progesterone is calming. From progesterone, you make more GABA. GABA is a neurotransmitter that helps you to sleep. Progesterone is neuroprotective, and it increases the production of myelin that helps nerves to work properly. It's like the insulation for nerves. So lack of progesterone is going to affect mood and sleep and immune function. Progesterone is very anti-inflammatory. And inflammation, I said neuroinflammation, is a problem with mood and cognition. Remember, they're interconnected. So we don't want to forget the important hormone progesterone. So we have circadian rhythm dysfunction, gut problems leading to both neurotransmitter problems, leading to inflammation that goes into the brain, micronutrient insufficiencies. You're going to have sleep disruptions for a whole host of reasons that I've described. It's like the total package that all comes together, in addition to all the other life things that are happening. Job stressors, marital stressors, kid stressors, parental stressors, to create the total toxic load on the emotional state of women transitioning into menopause and thereafter. So the solution is to have mind-body practices to increase the vagal tone, to improve the autonomic nervous system functioning. That's why mind-body practices, meditation, guided imagery, progressive relaxation, biofeedback, massage, acupuncture, these are vital. So we want to give hormones to replenish what we're not making. We want to do mind-body practices. We want to make sure we get a great diet to get the micronutrients and macronutrients up to speed. We want to do everything to heal the leaky gut. We want to do sleep hygiene and work on sleep, watch the sunset, make sure the room is really dark, give small doses of melatonin if needed. We need to do exercise. We need to do the whole gamut of lifestyle approaches. But hormones are foundational. Without them, nothing else is going to work properly. Check thyroid as well. Check for Hashimoto's. Do all the things to work up, rule out other causes of issues that can affect mood and sleep. But remember, estradiol and progesterone are life hormones. They're brain hormones. They're mood hormones. They're essential. And they're part of the treatment for every or almost every perimenopausal and menopausal woman. Always estradiol, bioidentical transdermal, and real bioidentical progesterone given to as close as possible, get the levels and rhythms of a woman at her healthiest.